Assalamualaikum warahmatullahi wabarakatuh. I'm Indah Severity and today I would like to talk about language disorder. So let's check this out. Yes, okay. I have my mapping before, and then we will talk the first about the terminology and definition of language disorder. So what is language disorder? Language disorder is a significant delay in the use and or understanding of spoken or written language. Yes, usually language disorder first appears in the early developmental period when children begin to learn and use language. Let's move to the history of the language disorder. Yeah, exactly. Language disorder have a long history. The first, when the SLP, or maybe we can call it as speech language pathologists, they went back to the Stanford conference in 1960s, and then they were interested in children who had difficulty learning a language, but they didn't have mental deficiencies, sensory and physical deficits, severe emotional, and so many more. But now we can call it as SLI, or specific language impairment. Okay, after the 40 years research, finally they have found that the children that doesn't have the deficit in their physical, the children had cognitive weakness that may explain at least some of the learning difficulties of these children experience. Okay, after this, let's go to the classification and characteristic. Yeah, based on the Bishop in 1997, the classification is divided into three parts. The first is aspect of language. Yes, in aspect of language, there are phonology, syntax, morphology, semantics, and pragmatic. Okay, the children who have deficit in phonology, they cannot arrange the structure, distribution, and the sequencing of speech sound. And then the children who have deficit in syntax, they have trouble in combining words into meaningful phrases, clauses, and sentences. And then the children who have trouble in morphology, they cannot arrange the word structure and grammatical word. And then in semantic, the children cannot be able to get the meaning of words and word combination. Yes, moreover, in pragmatic, the children cannot use language in social or in public. Okay, the next part is severity. Okay, the severity is divided into three levels. The first is mild, and then moderate, and severe. Yeah, exactly. The level here is decided by the pathologist or SLP. They can observe the children and then decide whether the children have the mild, moderate, or severe severity. Yeah, mild, moderate, or severe level. Okay, and then let's go to the receptive and expressive language disorder. Yeah, receptive language disorder is a child that has trouble to understand the words that they hear or read. Yeah. Meanwhile, in expressive language disorder, the child has trouble to express their thoughts and feelings. Okay, let's move to the SLI versus NLI. Yeah, so what's SLI? As I said before, SLI is a specific language impairment. Yeah, it is the children who don't have physical disorders such as brain injury or so many more, but they have language disorder. Meanwhile, NLI, or maybe non-verbal and language impairment, there is these children that have both the physical and language disorder, and exactly the impact is more severe than the SLI. Okay, so what's the symptoms of SLI? Yeah, in preschool age, children SLI may be first led to put words together into sentence, and then struggle to learn new words and make conversation, and then difficulties to follow direction, and then make frequent grammatical errors when they speak. Okay, in older children and adults with SLI, the symptoms may be limited in use the complex sentence, difficult to find the right words, and understand figurative language, have reading problem, disorganized storytelling and writing, and then they also have deficit in frequent grammatical or spelling errors. Okay, then let's go to the causes, diagnosis, and treatment of language disorder. So, what's the causes of language disorder in a child? Yes, language disorder can be caused by the brain disorder or autism, and then brain injury or brain tumor, aphasia, birth defect, problem in pregnancy or birth. Parents who have this disorder is also have a chance to get language disorder at their children. Yeah, let's go to the how to diagnose language disorder. Yeah, exactly. To diagnosing disorder, we can go to the SLP or speech linguistic ontologist. Yeah, that can diagnose, and then they will diagnose the language disorder by doing some tests to got the child's ability in comprehending and expressing language. Yeah, exactly. They can also do some tests like giving order or maybe play in group and so many more tasks that can be done by the children. Yeah. Next, what can parents do to help their children? Yeah, exactly. They can help the children with SLI or maybe language disorder by reading and talking to them to help them learn words, and then listening to and responding when the children talk, and then encouraging the child to ask the answer questions, then pointing out words and sign. Yep. So that's all the presentation that I have made before. So thank you very much for the attention, and if you have some advice and then additional information about the language disorder, then be hesitant to comment below. So thank you very much for the time, and I'm sorry for the mistakes. So assalamualaikum warahmatullahi wabarakatuh.